Good afternoon. This is the House Appropriations Committee. It's Wednesday, May 14th, 2025. It's just about 3 o'clock, and we are here to look at S53, which I have been calling the doula bill, but there's probably a more formal name for it. We have Jen Carby from Ledge Council and Nolan from Joint Fiscal Office to tell us about the bill. So take it away, please.
Great. Thank you.
Jen Carby from
That's me.
Office Legislative Council.
Nolan Langwell, Joint Fiscal Office.
So I will put up the bill. This is S53, which I have to say, I said I was going to go talk about the doula bill. So that's what we shorthand call it. But it is actually an act relating to certification of community-based perinatal doulas and Medicaid coverage for doula services. Sort of before we dive in, if some of you may recall, I think last year, we looked at a bill and the legislature passed a bill that it started out with an interest in having Medicaid coverage for doula services, and we're going to get into some definitions in a moment.
Okay.
But there was no existing mechanism for licensure or certification for doulas, and DEVA needed some way to have the providers who might be participating in the Medicaid program vetted to make sure that they were appropriate for providing services. And so the Office of Professional Regulation was directed to do a sunrise review on the doula profession and come back with a recommendation on the most appropriate form of regulation, whether registration, certification, or licensure. There's a great report on your legislative website from OPR, and they recommended certification, which is kind of the middle level of state regulation for a profession. This is a little different from a lot of the regulated professions because this is a voluntary certification. So doulas will continue to be allowed to practice in Vermont or perform their services without becoming certified, but they would not be able to be providing in the Medicaid program. So they'd not be able to get paid by Medicaid. So this bill is creating the certification and requiring Medicaid coverage. So I will give you the sort of high level version, but I do want to take you through definitions because I think they're helpful in understanding what we're talking about. So the first section enacts a new chapter in Title 26, which is where we regulate professions and occupations. It's for community-based perinatal doulas. And the first section gives definitions. They kind of build on each other, but they're in alphabetical order. So by the end of them, you should get the picture. First, certified community-based perinatal doula is a community-based perinatal doula who holds a certificate issued under this chapter. A community-based doula is an individual who provides doula services to under-resourced and marginalized populations at low or no cost, often through a community-based agency. A community-based perinatal doula is a community-based doula who provides doula services to individuals during the perinatal period. The director is the director of the Office of Professional Regulation. A doula, for anyone not familiar, is a non-clinical, non-medical individual who provides direct emotional and physical support and educational and informational services to birthing individuals before, during, and after labor and childbirth. And finally, perinatal is the period of time encompassing pregnancy, childbirth, and up to 1 year postpartum. So we're talking about certified under this chapter, community-based perinatal doulas. And then it goes through the fairly standard or some version of the fairly standard licensure or certification requirements about not using a title if you're not certified. But again, this is a voluntary certification. Duties of the director of OPR in providing information and granting application, awarding certificates, explaining appeals procedures and complaint procedures, keeping a registry of certified community-based perinatal doulas, administering the fees, and referring disciplinary matters to an administrative law officer. This is an advisor-based profession. So there's in OPR, there are board professions that have boards and professions that have advisors. This is an advisor profession. It would have 2 certified community-based perinatal doulas serving as advisors to the director. Eligibility to get certified, somebody would need to be at least 18 years of age, have sufficient and appropriate competencies in community-based perinatal doula services, which may be acquired through experience, mentorship, training, formal education, or a combination of these. So there's not like a doula degree necessarily from a 4-year college. That's not what they're looking at. They're looking at whether somebody has sufficient competencies from various sources and pass any criminal history background or registry checks. Certification is good for 2 years and has to be renewed. And we've got the unprofessional conduct statutes pointing to OPR's regular unprofessional conduct statutes in Title III. Section 2 just adds community-based perinatal doulas to the list of professions that OPR regulates. Section 3 adds community-based perinatal doulas to the list of professions for which OPR can inquire into the criminal background histories. Section 4 establishes the fees. And Ways and Means looked at this earlier today, $75 initial certification fee, and then the biennial renewal fee would be $120 every 2 years. Section 5 has Medicaid coverage for doula services and requires DIVA to provide reimbursement for a certified community-based perinatal doula for providing those same kind of doula services to birthing individuals covered by Medicaid during pregnancy, labor and delivery, and the postpartum period, regardless of the outcome of the pregnancy. And it specifies that they do not get reimbursement for travel time or mileage. Section 6 provides intent language that DIVA reimburse qualified doulas in amounts that are reasonable and adequate for the services provided and are consistent with the rates set by other states' Medicaid programs. Section 7, you're going to see a revised version of this in a moment from the House Healthcare Committee, but it's directing DIVA to seek a state plan amendment if needed, which we now know it will be needed to allow Vermont's Medicaid program to cover doula services. And Section 8 is the effective dates. The doula certification program would take effect on July 1st, 2026, with OPR starting the rulemaking process before then to make sure rules will be in effect on that date. And then you'll also see a slight change in the state plan piece, but having Medicaid coverage take effect on July 1st, 2026, or if a state plan amendment is necessary, which it is, upon approval of the state plan amendment, whichever is later. You want me to put up the healthcare amendment?
Yes, that was just one page.
Yes, it's just 2 instances of amendment. Here is the House Healthcare amendment. First, they were putting in a new section, striking out and putting in a new section 7 on the state plan amendment, giving a date, so not later than July 1st of 2026. DIVA would seek a state plan amendment to allow Vermont's Medicaid program to provide coverage for doula services. So the date certain is new, and DIVA had requested sort of a window of time within which to pick their opportunity when it felt like they might be successful in receiving approval for a state plan amendment. And then the second instance of amendment is amending the effective date for the Medicaid coverage to take effect on the later of July 1st, 2026, or approval of the state plan amendment. So it's not really any different, but it does get rid of the language about if one is necessary. And that's it.
I'm Nigel. I'm writing to Nigel. Nolan. Busted. Nolan.
I know how you guys really feel about me.
It's a thing called the budget coming up tomorrow. Yeah, okay. Forgive us, it's still out.
All right, so fiscal note should be on your webpage. There are 4 sections that I flag in the fiscal. So section 1 is per diems, and the bill would require the director of OPR to appoint 2 community certified doulas to serve as advisors in matters related to community-based doulas. The language allows them to be entitled to per diem compensation reimbursement under the statutes. This would not take effect until July 1, 2026. So it would be a It wouldn't be a fiscal year 26 issue, it would be a 27 issue. That said, it's two people, we don't know how many times, it would be very nominal, it would be extremely inexpensive, easily captured within their budget. So there's no, even in 2026, there's definitely no appropriation, but in 27, you would not need an appropriation there. I think it's so nominal. Next is the licensure fees. We actually went through that upstairs in Ways and Means earlier today. So I won't go through those again. It's estimated $4,500 to $7,500 in fees when it takes effect. And again, that would not be till 27. The next one is one that is the reason I believe that it's here, other than the PDMs.
And the Medicaid.
And the Medicaid. Okay, there's three reasons it's here. And basically, this would require DEVA to provide reimbursement to doulas once they get the state plan amendment. So the idea behind this, we saw several estimates of what it would cost to do. That said, there's only about 70 to 100 registered doulas. I looked at research and stuff from what other states' experiences that have had this, and they found that in the first several years, the uptake was very low, partially because you had to get the word out. People, when they want to become Medicaid certified, they have to go through a process. They have to create billing systems. So there's a lot of barriers to make it happen quickly. So in the short term, it's very likely that the impact would be, let's say 10% of doulas, so that'd be like 7 to 10 would, start using the services. We feel it would probably be about 176,000 in the first couple of years. And then as it goes on, it would be more. Now, anyway, so there's another piece I wanted to flag on this. Yeah, it's assumed the utilization would be low in the first couple of years. It definitely wouldn't exceed 400,000. The out years could be a little higher, but again, that depends on the availability and awareness of doulas and the utilization of beneficiaries who use them. So these are just specific to Medicaid beneficiaries. So you are committing to potential Medicaid reimbursements in the out years. There are some other studies that talk about how doulas actually can help reduce costs in the system. There's no way to really capture that. But there is a potential that, you see small increase in reimbursement rates to this, but there could be some potential offsets as well, as they tend to have different outcomes, et cetera. The last piece is there's an appropriation. That's right. For OPR, you did put this in the budget, and it was captured in the conference committee for $25,000 one time to the Office of Professional Regulation to get this particular profession oversight up and running.
And I'm gonna phone a friend with Maria, and did it just go in the budget? I didn't see it as a separate bill. It wasn't a separate.
It was in the budget. The 25,000 is in the budget.
Just in the budget. Okay.
Yeah.
And that was a one-time.
One time.
Yeah.
With all the other first
Right.
time.
Okay.
And then I just have a little note here, as of 2024, at least 13 states and District of Columbia did provide Medicaid coverage for doulas. However, utilization of doulas by Medicaid beneficiaries appeared to be low despite demand in the first couple of years. That's
a question probably more for Jen, but many states have done this and added it to their Medicaid program.
I'm gonna look to Nolan because
I
he's
just said that 13 states,
How many?
13 states in the District of Columbia.
And they've all been accepted to be able to use Medicaid dollars for it.
What I have here is from what I had researched, it just said, as of 2024, January, at least 13 states in the District of Columbia provided Medicaid coverage, which means that they have received approval to do so probably soon.
Yes, I'm seeing it in the budget in B 1100 AA Secretary of State. Wayne?
Is there any evidence of this, any cost savings, coming out of these programs?
So
Are there any costs that would be incurred if the service wasn't in place that would in part defray
yes,
costs?
So another piece I found when I was reading the research and it's in my fiscal note says the usage of doulas has been found to reduce the frequency of C-sections, low birth weights, and premature labors. So doula intervention has been correlated with a decrease in epidurals, skin, used during a delivery, increased rates of breastfeeding, and the use of safety precautions for the child. So all those things contribute to cost savings, or sorry, say reduction of spending.
Mental health.
Mental health as well has been flagged in here. Effective strategy for improving mental health, especially among socioeconomically vulnerable and marginalized minority populations.
Any other questions?
Yeah.
Right, oh, Tom, your hand was.
I'm just the doulas would not receive mileage or other reimbursements. Is that common with Medicaid spending with people who travel?
I think so. I'm thinking about like home health. I don't know if that's built into the reimbursement rate or into their administrative costs. So it's a good question. I don't know the answer.
Can I make one up?
One or the other, you get a 50-50 chance.
Yeah, right? Yes, no, or
Right, you
twice.
can make it up.
No, thank you. Good question.
Dave,
So these are, yes, thank you. Following up on Wayne's question, these are out of hospital costs compared to somebody who had their child traditional way. It's going to be through the medical system and higher reimbursement. No? Yes?
So like Washington County Mental Health, they have doulas.
Right, so doulas might go to somebody's house while they're pregnant. They might be in the hospital room if somebody is giving birth in the
Oh,
hospital.
okay. So they can
They're
go
often, they're often supporting right in the room, hospital room. There's a lot of follow-up after.
No, not necessarily.
Right, so not necessarily.
And so the total cost liability is 25,000?
No, the total appropriation needed in 26 is 25,000 for OPR.
For
For
OPR.
OPR, and then in the future, Medicaid reimbursements in the first couple of years might be as low as $176,000 general, which would be 400,000 grow,
Probably in FY 27.
Yeah, and I wouldn't expect them to exceed more
I see.
again, because like I said, the uptake in the beginning is usually pretty low. It takes a little while for it.
Yep. And you base that 176 number on how many?
Well, that was based on information that I received from DEVA, where they had done a determination of what would the rates be, the terms of reasonable, what do you think utilization would look like? And then they had different ranges of uptake, and I took the 10% range because that seemed that was fair.
10% of the total 5,000?
10% of all Medicaid pregnancies. I forget how many there are in a year. I probably have that in my fiscal note too.
That could be.
Let's see here.
Thank you. Noel.
Used to have it in my fiscal note. There was 2,033 Medicaid births from 2021 on average between 2021 and 2023. So if you assume there's 10,000 or 2,000 births under Medicaid, and 10% would be like 200 people.
Okay. Thank you.
any other questions?
Just one, real question, is this typically also covered by traditional insurance if you were not on Medicaid, like Blue Cross or MVP?
Don't believe so. Although I think this may be the one that Blue Cross is looking at covering. They look doing a pilot.
They did do a pilot. I remember hearing about that last year, but I don't know where they're at with it.
Yeah, no, I'm just curious. I mean, they should be looking at it. If in fact saving money in other areas, then there may not really be a cost to it, but just looking for some examples that the commercials were doing it. Probably a good indication that they feel they're saving money if it's not a requirement that they cover.
You don't know the answer.
Yes, although I think many people pay out of pocket for doulas when they're not covered, and this is a population that may be less able to pay out of pocket for a doula, and so would not
Are there any
seek service.
guardrails on, I think it said that you can get help like a year after or something, up to a year after.
Right, at the end of the perinatal period.
If your provider, is there any guardrails on them saying, well, I need to see you weekly for the next 52 weeks and they'll Medicaid accordingly?
I'm guessing that Medicaid would have some of those parameters in their administrative rules. But no, there's nothing in the legislation that says that, but we also don't say that for any, for most services.
You have a comment from the audience, just introduce yourself.
Beverly Bogat from the Vermont Early Childhood Advocacy Alliance, and I'm working with the Vermont Doula Association of Vermont. Thank you for taking up this bill. My understanding in terms of guardrails, DEVA did an analysis last year, because last year you passed a law, and in their analysis of reimbursement models, they had a maximum, well, they would pay per visit a certain amount. They had a maximum of 2,100 in their modeling, and that is in their report back to all of you in their budget presentation.
So for dollars, costs.
$2,100.
And
I'm sorry, reimbursement
reimbursement.
to the doula per birth.
Okay,
I mean, per family, yeah.
right, reimbursement to the doula. Okay, and then we have, okay. And we have somebody from the Secretary of State's office. If you want to introduce yourself, Lauren?
Good afternoon, for the record, Lauren Hibbert, Deputy Secretary of State. I just wanted to add that in addition to that, also with the regulated by the Office of Professional Regulation, if there was evidence where someone was fraudulently going more than they need to go, we would prosecute them. And we do see that in other areas with Medicaid, Medicare fraud, and we do investigate those and we do prosecute those along with the Attorney General's.
So this came out of healthcare 11-0. I don't know who the reporter of the bill is from healthcare. It came out.
That's Representative Cordes.
Oh, Cordes, Mayor Representative Cordes, great. And then it came out of Ways and Means 10-01, and Representative Brannigan is really on that bill. Okay, so if there aren't any other questions,
I just have
one more. Okay, sorry.
I'm curious about what it costs someone to have to do with the provided services. Like you said, there's a cap of
Right, so that would, so
what
right,
it might be depending on what they're providing.
right now, and sort of kind of back to your conversation again about, right now, we don't know of any insurance companies in Vermont that are paying for this. Blue Cross did do a pilot, we're not sure if that's continuing still. If people pay privately, there's quite a range
There's a range.
of what people are charged for these services that are paying out of pocket. But if they're being reimbursed for Medicaid, that would be the total, there would be no additional.
That'd be fine. Yeah. I'm just curious.
And Dave, one more question?
That covered it.
That
Thank
covered it?
you. Yep.
Okay, great. So if there's no further conversation, let's see, do we have to do this two votes? No, we just as amended or something?
Yeah, so you report it,
That's part of the Senate.
Yeah.
Further
Amended by,
yeah, so just as recommended, yes, as
okay.
report favorably on the report of the
Is there a
Committee on Healthcare.
John? Okay. Seeing no further questions, when the clerk is ready, you may call the roll, please.
Ready? Representative Blumer,
Yes.
Representative Dickinson,
Yes.
Representative Harrison.
Yes.
Representative Konsenska,
Yes.
Representative Roche, Yes. Representative Rowicki,
Yes.
Representative Squirrel, yes. Representative Stevens,
Yes.
Representative Yakuboni,
Yes.
and Representative Stein.
Yes,
10-0,
go ahead.
10-0.
Thank you. And this is an OPR bill. So Rep. Maricki, I think this is yours. Right, OPR? Thank you both very much. I know you have meetings, you're running around and we appreciate it. Committee, after much toing and froing.
No joke.
Not live. I want to have you, don't want to do live.
Hang on. Pause a moment. Tomorrow morning, we're meeting at 10 with S-127. That's the housing/CHIP bill. That's a change from what we had earlier. And then the healthcare bill, S-126, will be after the floor. And we will be voting on each of those bills after we hear them. So one more shot at taking a look at how they Came out, oh, and then the housing bill came out of Ways and Means 902. So, and if there aren't any other questions, let's go on 5, Anna.